Hi, I'm Jim Koske from Orthopaedic and Spine Center, and today we're going to talk about a treatment that we do here called cupping. We use these cups here to help release soft tissue and decrease tissue tightness in various areas in the body, and it also increases blood flow. They've been using this kind of a method for years over in Asia, and so recently we've been adopting it here at our clinic. So I'm going to show you how we utilize this particular treatment for someone who may have neck pain or shoulder pain. Okay, so this particular setup uses a gun which takes out the suction, which will provide the suction of the skin. Okay, there's other cups out there, some that are glass. These are plastic. Some that are glass, they don't have this little apparatus. And what they'll use is they'll use a flame. They'll put a flame inside the cup real quick and then put it on. And that heat will actually draw in the skin and act as the vacuum. Okay? The painful part, there's really, people, if I just put it on and leave it, like so, that's fairly comfortable. It's not painful at all, is it? Yep. But where it does come in a little discomfort is when I'm starting to move the cup, like so, it'll be like a little stingy, pinchy kind of feeling. And I can adjust the pressure that it's applying. Also, maybe when they're doing the exercise, they may feel a little stretching or pulling in the area. But overall, it's been a fairly, comfortable treatment. And when I go over the affected area, the painful area, then it gets a little spicy with that. And we just adjust it and work around it. And then what I find that tender area, I leave the cup over it and we do our exercises. And I've had some pretty good responses with that. So we're going to put a little lotion on the area. So I'm going to treat his upper trap and part of his neck, because he's having some upper trap issues and some lower neck issues. I take this little cup, and what happens is we're going to use it as a little vacuum. We come in here, we use the gun. Notice how the skin puckers up underneath there. You notice how it's starting to get a little red? That means it's drawing blood up into the area. So we're getting some good nutrients into the soft tissue, and it's also putting a little stretch on. And now what I'll do is I'm going to move the cup. And I can get different areas. And you notice it's starting to turn red. So that's a good, what we call histamine response, and we're getting some good blood flow in the area. And so what it's doing is we're pulling on it. Instead of pushing down on the muscle, we're actually pulling up on the soft tissue, releasing some tightness and helping with the pain. And so what I'm going to do is I'm going to find his tender area. Where's your tender area? Right about in here. Or over in here? Here? Okay. So now what I'm going to do is I'm going to have him do a couple of movements to help actually release the muscle even more. So I'm going to have him turn his head to the right. And he's going to look down. And notice how this all stretches out, but the cup is still in that place. So I'm going to have him do that 3 times. Back, and then he comes back. And if I wanted to add a little bit more, I'll have him pull his head down into his armpit. Okay, back. And on this next one, go ahead and pull your head down into the armpit. And now he gets a really good stretch. And if I wanted to, I can leave him there and do a little more movement with the cup. Okay, he comes back. Okay, now maybe his shoulder's bothering him. So I'll have him bring his arm up, palm up, and he's going to come and reach back behind his back. And he can grab it with his other hand and pull it across. Now we're getting a good stretch. We can add in the neck as well. So he brings the arm back out, and I'll have him do that 3 or 4 times. And he's getting a lot of blood flow into the area, good muscle stretching and soft tissue stretching. Okay, after he's done with that, then I'll leave it on him for a few minutes, and I'll increase the tension. Okay, and now I can just leave that there, and it'll cause, you know, I'll leave it on for 5 or 6 minutes, maybe longer, depending on how long it's been on them. And so this is causing a really good blood flow, stretching of the soft tissue. And then when he's done, I'll take it off, and he has this nice little mark here, almost like he got into a fight with a vacuum cleaner. And this mark may stay for a day or so, but it'll go away. And it's not tender at all. Okay? And then pretty much that's the treatment. We can do this for the neck, shoulder, backs. I've had really good success. People with the lower backs coming in with tightness and stiffness in that area, having them put on 6 cups in one area and have them go through an exercise routine that I've come up with. And then that's, you know, they'll get off and they'll say their back feels a lot more flexible and mobile. So that's cupping here at OSC. Thank you.